Hey everyone, it's Dr. Rick, founder of Herbal 411, and today's topic is on which blood tests I would want to see on my patients as baseline testing. I just did a video on peptide patches and how they can help you with increasing your HRV, increasing your bone thickness. Now that's all anecdote, but there is some validity to shortcutting your way to optimizing health. Dave Asprey, an engineer, came up with the term biohacking. I'm a boomer. I don't mind shortcutting. In fact, I'm at 62 right now, and to me that's midlife because I want to live till 100. But for a lot of patients that are the average American, that's already close to death. If you think about it, the statistics show that women will usually die or have some kind of problem at 78, men 72. I got 10 years to do something about it. And what would I do? I'd try to optimize my health. Exercise, eat properly, sleep deep, love. But that's impossible because you have to work all day long and do 12-hour shifts in an immediate care center. I think there's a balance that has to be struck. Even if you feel okay and you look okay, I would still go down to the cellular level to see how the cells are behaving. I love exercise and resistance. A lot of muscle heads that say, I'm doing fine. I can bench press twice a you, doc. And I'm like, impressive. But can you run a 5K, do a marathon, perform a yoga class? Can you also have a low insulin level or a low LDL? Or will it suit your blood pressure is now, smarty pants? At the opposite end of the spectrum is my yoga practitioners and my runners. I have a lot of them that are actually insulin resistant, or their HDLs and their cholesterols and they're sky high. If you have a good physique and or you're flexible and or you can do a marathon, but then again, your cholesterol, your blood pressure, your insulin, everything shows that you're heading towards a major catastrophe. Data is important. The outside morphology and looking in the mirror, no questions. Good. I'll start with this. It's a free cortisol that you can get without even giving blood. Now, I've done a video on this. I love the value of this because I used to do blood levels. But the thing with blood levels, especially with early morning hormones, is you have to get dressed, you have to drive through traffic, you have to get to your destination, which is usually a bloodletting center. And then you have to get stuck. Not to divert, but I just got my blood tested. Yes, I love experimenting on myself. And I had to look away like this. The lady was here and I was looking away at the Quest over on Higgins Road. I was okay, taking some deep breaths, trying to stay calm. I could hear her because, the tray that she was using was metal. Dropped the first vial of blood. I was like, 1, 2, 3, it's like number 7, number 8. Oh, this is never ending. So that alone for me was already changing my cortisol level. So that's why I think this is important. That's a salivary free cortisol level. Second thing, I would always get a DHEA to match that. It will tell you in the morning what your adrenals are doing. If you have an adrenal issue, then sometimes I would want to also see a aldosterone to renin ratio if you're a hypertensive. As far as thyroid tests, if you could do the test before you take your pill or you take thyroid medicines, if you take iodine or any of the thyroid cofactors, you stop them 3 days before the test. The TSH, the free T3, the free T4, the reverse T3, and for some people, the 2 antibodies to the thyroid. I don't think you have to do those every time if they're normal in the first blush of blood tests that we get. You don't have to repeat that every 3 months, but if you're showing signs of hypothyroidism, or it runs in the family, or I'm feeling a big goiter, I might do those in addition to urine iodine levels. You really have to do a 24-hour urine test. I used to do spot urine tests for iodine, not anymore. Then I checked the gonads. I think the blood testing for testosterone, total and free, for both a male and a female are important. For the women, I also get estradiol and progesterone. And depending on what's going on with the woman, if it's a young person that might have polycystic ovarian syndrome, it's also important to check an insulin level in addition to the testosterone level. So those 2 markers are usually off. Or going through premenopause or menopause, it'd be important to check FSH-LH and the ratio. So those are the 3 big glands. That's the thyroid, the adrenals, and the gonads. Going to the next blood test, I'd always want to see what your CBC and your comprehensive metabolic panel test. The CBC is to look for anemia, to look for red blood cell morphology, that's the MCV. It'll give me a hint as far as whether the red blood cells are huge, like B12 or folate deficiency, or tiny, like chronic iron deficiency. In some cases with sickle cell, I found that too with a very small MCV. Anemia is important for people that are B12 deficient, plant-based, or vegans. Iron is also important for women. I have a couple of men that have been iron deficient. I was one of them, but I also practiced veganism for about 3 years. If you have a male that has a low iron, or low ferritin, I would worry about that because you're losing iron somewhere, and that would be in blood, and you shouldn't be having blood in your stool, but sometimes it can be microscopic, or you could be breaking down the blood and not making it up again. As far as the standard things, every doctor gets a comprehensive metabolic and a CBC. After those two tests, the comprehensive metabolic giving us a glucose level and liver and kidney function, then I get metabolics. Metabolics can be in insulin levels. Leptin and ghrelin, I don't really get those unless I have somebody that's really insulin resistant. Those are two hormones that are released from fat and stomach lining to tell you, stop eating, I'm full. Or start hunting because we're starving. But both of those signals, in addition to an insulin level, are pretty decent to say whether you have resistance or not. Hemoglobin A1C, and then fasting glucose. The comprehensive metabolic panel comes with the glucose, but if you want a 3-month average of glucose, especially if you're a pre-diabetic or a diabetic, you have to get a hemoglobin A1C. If you are using insulin, then you might want to do a different test, but we're not getting into that. That's more my specialty services. I'll also get a beta hydroxybutyrate. That's for people who are practicing intermittent fasting. So people who practice intermittent fasting, which is essentially pushing off breakfast till a later hour or skipping breakfast, the value is there for a short amount of time. That's caloric restriction when you push back breakfast or your first meal of the day, meaning you extend your fasting window. When you do that, you will trigger insulin sensitivity. That's the way the body works. This body is so adaptive. If I throw an exercise in my way, I hopefully will be able to change muscle girth and muscle strength and endurance. If I get into a different protein profile or change around calorie intake per day, the body will change and adapt to take the new input, the new signals, and then work with them. Body always adapts to that, so that's why it's important to periodize. But before you periodize, get the blood test, get the saliva test, maybe a DEXA scan, and then periodize and repeat. That gives us essentially all the glands, and yes, fat and muscle are glands too. Muscle works, has a strong hormone signal and neurological input. You do have these things called hope molecules that are released from muscle contraction. You also have endorphin and enkephalin that's released, and all those things are valuable to keep you motivated, to keep you going forward and continuing the healthy activities. Next test. It's not a blood test, it's not a saliva test, it's a scan, it's an x-ray, fancy x-ray that typically is used to look for bone mass. I just did that recent video where I noticed for the first time in a couple of years, my bone mass increased. And I think that's significant because I've always been exercising, whether it's running, cardio, cycling, or resistance. In the amount of years I've been getting a DEXA scan at LiveLean RX, I have never had my bone thickness increased. It was only this patch that I started using about 30 plus days ago, and my bone mass is better. So I have to tell you, for those of you who are osteoporotic or osteopenic, you might want to consider peptide therapy. And this is the company that I use, LifeWave. Even in the case of heart disease, and I've had a CTA, essentially a test where they inject you and they see what your arteries are doing. The CTA that I did, I'll be talking about that soon, but it was questionable about a year ago, right before I went to Mount Whitney with an excursion that I held. I got cleared, but I made the changes and I've been applying them now for about a year and a half. And then we'll see what shows up. Those of you who can't afford or can't get your doctors to write for a CTA, that's a coronary angiogram. I think that the old one, the CT calcium score, kind of gives you a rough estimate for how much calcium you have in the arteries, the 4 big ones, but it's not as accurate as a CTA. I don't just get the 4 lipid panel. That means the LDL total, the LDL calculated, the HDL, and then the triglycerides. They're calculated numbers. I'd rather have a cardio IQ, which also breaks it down into LDL particle count, small LDL, medium-sized LDL, large LDL, And then apoprotein B and LP-little-a. Those are very valuable markers that have shown more relevance than the 4 standard ones. If you have heart disease or if you're on a statin, you can just go with the LDL and see if you can slam that thing to the ground. I've seen some people get to an LDL of 10, and I thought, whoa, that's way too low, but my cardiologist wanted that person to be that way. If you think you're bulletproof and you think you don't have heart disease, I challenge you to get those tests. We've talked about the 3 glands. We talked about your metabolism. We talked about those risk factors for getting heart disease or not getting heart disease. And then maybe a DEXA scan. Finally, it's always easy to get blood pressure. You can do that on your own. If you get your blood pressure in the office or in the immediate care center or in the emergency room and it's always elevated, there's something called white coat hypertension. But that usually means that you got to work on your calming practice and the stress in life. And for those people who say, I don't have any stress, well, it can certainly be because you're taking the wrong type of sodium in, which is all processed, and you're not taking enough minerals. Or it could be because you don't have enough magnesium. It could be because you don't have any sleep. It could be because you have sleep apnea. I think a blood pressure is so easy to get. If you can measure it on your own in the seated position, both feet on the ground, waiting in silence for 5 minutes, and then checking your blood pressure twice a day for 5 days, that's the way it should be. You can still also get a couple other things as far as vitamins. B12, iodine, iron, yes, ferritin, vitamin D, magnesium, RBC, and omega-3 levels. If you have chronic headaches, I get B2. If you have total fatigue, I get B2, B3, and melatonin. That usually comes in a urine test. So I guess we can stop there because it kind of depends on what else is ailing you. If you have other problems like stool or gut issues, I'd get a Genova GI Effects 3-day test that also tests your stool for microbiome, short-chain fatty acids, or postbiotics in addition to parasites and other things of inflammation, zonulin too. I think that's a great test, but it's not always covered by insurance. So short of that, I think those are the best tests to get as a baseline, and then moving forward, you implement changes of some sort, and you repeat a couple of those. You don't have to repeat them all, but depending on your medical problem, you repeat and see, did your implemented changes make a difference or not? Whether you do shortcuts or whether you just want to implement a lifestyle change, if you only go by your scale, weight, maybe your waistline and your hip line and your waist to hip measure, or your blood pressure, I think those are rough estimates to say that your implemented change is working, especially with regards to metrics like the Garmin or the Oura or my Morpheus strap or auto sleep with my Apple Watch. I don't think I want to include biometrics in this video because I've done another video on them, but these are the tests that I would love. And I'll put a summary down below. Ask your doc if they would do them. If they don't, you can always go to walk-in labs, and that's where you pay for your own tests. But you can see how all these tests start to accumulate. If you have good insurance, your primary care doctor might be able to write the right diagnosis. A lot of you that are just going for your wellness, annual wellness, insurance companies won't cover these. They'll cover basics that will say that you're alive, but they won't really give you guidance as far as what to do. That's just the way it is. Insurance is usually there for catastrophe, but as far as lifestyle changes, insurance doesn't care about your lifestyle. So hopefully this gives you a couple of ideas of the way I approach things. If you have any questions, put them in the comment section down below. Please consider subscribing to my YouTube channel. The next video is going to be on my mind as far as memory, and then my sleep as far as anxiousness and the use of those peptide nasal sprays. But I try to empower people all the time, so hopefully this helps. If you have anybody that's suffering, please share this with them. Otherwise, I'll see you at the next video.